Now, okay, before we go into the risk assessment, can I just check if there's any questions? Okay, so far wala pa. Okay pa naman?
Maraming questions sa Karen actually, pero we will acknowledge them later after
Okay,
your
sige.
presentation. Ayun.
Okay,
Ang dami
sure,
ng
sure.
ang dami ng questions sa YouTube actually.
Sige.
Yep.
Okay.
Yan.
Ayun.
Mm.
So, okay, we go now to risk management and risk assessment. So, as I've mentioned earlier, when we're working with certain experiment setups, when we're working with certain equipments, we have to make sure that we are aware of what are the hazards of these equipments and what are the control measures that we can employ to make sure that we make use of them or we implement these experiment setup safely. And so dito na papasok yung risk management and risk assessment. So first, what is risk management? When we talk about risk management, it is a systematic approach to identifying or assessing the risks that are associated with any work activity. So that is what we call risk assessment. We communicate this risk to all persons involved, and we control and monitor such risks. And so, actually, a very big part or integral part of this risk management is yung tinatawag natin na risk assessment. So why do we need to, this is first, ito muna, yung risk management process flow chart. So first, you have to prepare, form a team to perform the risk assessment and gather the relevant information. So ito yung mga kailangan mo na preparations before you work on the risk assessment. You have to assemble a team. They have to be knowledgeable of what is the experiment to be performed or what is the equipment that has to be worked on or operated, so that they can advise kung ano ba yung mga hazards that are present when working with these experiments or with these equipments. And usually, ang members nito will be, of course, your researchers or students that will be working with that particular setup or equipment, the principal investigator or the PI, who supposedly will have more experience with these particular setups, as well as, for example, merong research fellow or postdoc who can also help guide. So these are the main members of your risk assessment team. If you have service engineers or equipment specialists who can also assist in preparing these, then that would also be very useful. If you have safety health officers in your building who can also help, then please do include them in the formation of this RA team. Of course, you have to gather relevant information. We will cover this a bit more later. Second is hazard identification, to identify the hazards as well as the potential accidents and incidents that may result from these hazards. Third is risk evaluation. So you estimate the risk levels and prioritize the hazards that has to be controlled. Fourth is risk control. So the risk control will include the formulation of the control measures that has to be implemented. These will be according to the hierarchy of controls, which we will cover later on. And then analyze and evaluate the residual risk. So acceptable ba or hindi yung residual risk after employing certain risk controls. Number 5, record keeping. So it is important to keep a record of your risk assessment for 3 years. Pero please take note that you don't just keep it in record na, okay, nagawa mo, and then itatago mo na, then that's it. So it's not just a paper exercise. You have to make sure that you implement it. You have to make sure that all subsequent users or students or researchers that will be working on these experiments or equipments will have read and understood this risk assessment. So they will be able to be more competent and confident in performing the experiments or using the equipments safely. And yun, doon papasok yung implementation nga. The review will be every 3 years. It can be reviewed again after as needed if there is new information given kapag merong nagbago sa work process mo, and in the unfortunate uh, case wherein magkaroon ng accident or incident, that means hindi nag-work yung risk assessment and the controls. And so you will have to reevaluate your risk assessment. So these are the different steps of the risk management process. The risk assessment will be covering this part wherein you identify the hazard, evaluate the risk, and establish your risk control. And so, these different parts consist of the overall process flow chart for the risk management. Now, again, at different parts of this flow chart, actually, different parts of the process, you need to have constant communication, not only among the members of the risk assessment team, but as well as with other stakeholders. So other members of the research lab or other users of the facility, in case meron din silang mga feedback or information that they can share with regards to the particular experiment or equipment. And subsequently, once you have the risk assessment, you also have to make sure that you communicate it properly to all who are involved, to all who will be using that particular equipment setup, as well as to the management of that lab, because they also need to keep a record of this. They also need to make sure that the things that you are do have the proper risk controls and that you are doing properly. So this communication is a very important part in this risk management flow chart as well. Okay, so yes, we will be addressing the questions later. So actually, I'm again using as a reference to these my experiences, the materials that I have also learned from my experience and the trainings that I attended from the National University of Singapore. So again, much thanks and acknowledgement goes to them. So for giving me these learnings that I'm sharing with you as well. So yung Occupational Safety, Health and Environment Office of the National University of Singapore is responsible for taking care of the overall safety and health of NUS. And actually kasi 'di ba parang kapag yung mga safety health officers natin minsan parang hindi natin na-appreciate. We consider them as parang mga villains. In terms of like, okay, eto na naman to, kumbaga na they sometimes can hinder intentionally the things that we do in the lab, not because they wanted to, but because they have to ensure that we do it safely. So it's that we have to recognize that that is their purpose, and so we have to work with them so that we'll be able to find a compromise so that we can do our research without also endangering ourselves. So yun naman yung gusto nila, that we work together, that we do our things safely. So we work with our safety health officers.